Dear students, welcome back. In the previous session, we have discussed about osteokinematics of knee joint in that flexion and extension. Now we are going to discuss about the osteokinematics of the rotation. Okay, so here also you have to focus on whether tibia is moving on femur or femur is moving on the tibia. You have to focus. Okay, now the axis of motion for rotation at the tibiofemoral joint is a longitudinal axis that runs through or close to the medial tibial intercondylar tubercle. Okay, so it is a longitudinal axis. So we are seeing this one in the superior aspect, isn't it? So the tibia and the foot we are seeing now, that means this is the superior view. Okay, yes, so it is passing longitudinally. Okay, so which is located very close to the medial tibial intercondylar tubercle. Okay, during lateral rotation of the knee, during lateral rotation of the knee joint, the medial tibial condyle and the intercondylar tubercle. So this medial tibial condyle and the medial intercondylar tubercle acts as a pivot point. We can call it as pivot point. On this point only, so this is the axis. On this axis, so now this tibial condyle, okay, this tibial condyle will move, whether it may be in internal rotation, how it moves. So here this is the arrow, and external rotation, how it is moved, this is the thing. Okay, now we will see in detail. Okay, when knee lateral rotation is produced with the tibia, okay, with the tibia free, that means it is an open kinematic chain. Then what happens? The medial condyle, so here you can see the medial condyle moves only slightly anteriorly on the femoral condyle. So this is in the open kinematic chain. Then what is happening? This medial condyle of the tibia will move slightly anterior on the femur. Okay, slightly anterior on the femur. Okay, while the lateral tibial condyle moves a large distance posteriorly. On what? Lateral femoral condyle. This is the lateral rotation of the knee joint. If you see in the medial rotation, the direction of motion of the lateral tibial condyle reverses. So here the same thing, what it has done in the lateral rotation or external rotation, it comes in the same direction internally. Okay, yes. While the medial intercondylar tubercle and the medial tibial condyle continues to act as pivot. In this direction also, this is the pivot point. Okay, in weight bearing, so this thing we have seen in the closed kinematic chain. In weight bearing, that is closed kinematic chain, the lateral femoral condyle, so closed kinematic chain means which bone is going to moving on which? The femur is going to move on tibia. Yes, very good. So next, so what is happening? The lateral femoral condyle moves posteriorly. The lateral femoral condyle moves posteriorly. That is femoral condyle. Femoral condyle is moving posteriorly on the lateral tibial condyle. Okay, so in the lateral rotation of the femur. Now, next, the femur So, and anteriorly, so this femur will move, the femoral condyle will move anteriorly on the lateral tibial condyle in the medial rotation of the femur. Here also the pivot point remains at the medial condyles only. However, with lateral motion exceeding medial rotation. Okay, if the lateral motion which is going to exceeding the medial motion, then the pivot point is going to change. So the range of knee joint rotation is dependent on the position of the knee. When the knee is in full extension, it is in closed pack, that is called locked position, and the ligaments are taut, then no rotation is possible. During extension, no rotation, full extension, no rotation is going to take place. Okay, if the tibial tubercles are lodged in intercondylar notch and the menisci are tightly interposed between the articulating surfaces in the fully extended knee. Okay. However, when the knee is flexed to 90 degrees, the ligaments are lax. Okay, the tibial tubercles are no longer in the intercondylar notch and the menisci are free to move. At 90 degrees of knee flexion, approximately we will get 60 to 70 degrees of either active or passive rotation is possible. Okay, the range of lateral rotation is 0 to 40 degrees. Okay, whereas which is slightly greater than medial rotation, so the medial rotation is 30 degrees, 0 to 30 degrees. Okay, with maximum rotation available at 90 degrees of knee flexion. Okay, rotation diminishes as the knee approaches both full extension and full flexion. That means in full extension no rotation is taking place, and also in full flexion also no rotation is taking place. You will get maximum of range of motion of rotation at 90 degrees of knee flexion, and it is going to be decrease when the knee flexion is increasing and or knee extension is increasing. The range of motion of this rotation is going to decrease. So at which range of knee flexion we will get maximum rotation means at 90 degrees of knee flexion we will get maximum range of rotation, and we will not get any rotation, that is zero rotation in full extension, and very much less or diminished rotation we can see in full flexion. Okay, because I have explained what is happening in full flexion and in knee flexion we have to consider. So this is all about the osteokinematics of the rotation. In the next session we are going to discuss about the arthrokinematics of the knee joint, which includes flexion, extension, how what are the intra-articular motions, how the femur is going to slide or glide, whether it is moving anteriorly or posteriorly on the tibia, okay, or whether the tibia is moving on the femur, how it is going to move. Everything we are going to discuss in the arthrokinematics in the next session. Thank you.